In a report into illicit narcotic overdose death in British Columbia, it was identified that there existed a very real and serious problem with an inordinately high number of deaths associated with illicit use of heroin and other opioids. Unconventional measures were recommended to combat this issue. However, this report was done over 27 years ago, in 1994. The number of drug-related deaths in British Columbia peaked at 330 in 1994. In 2020, however, there were 1,548 drug-related deaths in British Columbia, with as many as 185 deaths in 1 month. In fact, this high drug mortality rate is present throughout the entirety of Canada. Between January of 2016 and June of 2020, there existed over 17,603 apparent opioid-related deaths and over 30,000 opioid-related hospitalization, and over 1,628 of the deaths occurred only between April and June of 2020. The death rate is also further increasing due to the ongoing COVID-19 pandemic. Canada is in the middle of a crisis, an opioid crisis. So, opioid is a class of many drugs that work by changing the brain's perception of pain by attaching to opioid receptors throughout the nervous system, creating a perception of relaxation known as euphoria. Opioids are no new substances. On the contrary, opioids are among the world's oldest known drugs. The earliest known evidence of opioids dates back to Neolithic period, around 5,700 to 5,500 BC. And the use of opium poppy for medical, recreational, religious purposes can be traced to the 4th century BC. During the 1980s occurred the first instances where opioids were used to treat chronic pain, and in the 1990s, the development of new methods to administer opioids for pain treatments made opioids safer and more popular. In 1996, opioid usage saw massive expansion. Purdue Pharma, for example, aggressively marketed and promoted oxycodone, a synthesized opioid remedy. In present times, opioids' many usage made it a popular form of medical treatments. They are commonly used for medically relieving pain and after surgeries and after other causes. Opioid is extremely important in palliative care to help with chronic pain after severe conditions such as cancer. They're also used to suppress diarrhea, suppress cough, and many other conditions. Common prescription opioids include oxycodone, morphine, codeine, and fentanyl. To one's surprise, weak opioids in low doses and combined with other drugs are actually commonly available without prescription. One can easily find them in pharmacies, so in medicines such as cough syrup. But of course, opioids have many negative effects. Short-term consumption of opioid can cause drowsiness, nausea, and vomiting. If not careful, overdose of the drug can result in great damage to the respiratory system and even death. Long-term opioid usage can cause tolerance, which means that larger doses are required to produce the same effect. Opioid can also cause physical dependence on opioid, making users vulnerable to withdrawal symptoms if they do not consume doses of opioid regularly. Withdrawal symptoms can include severe discomfort, severe pain, and even mental trauma such as depression. To make situations worse, opioid usage, even within prescribed amounts, can easily cause addiction. Also, sharing needles with others for the injection of opioid greatly increases the risk of getting certain infections such as HIVs and hepatitis C. Without a doubt, opioids are extremely dangerous and thus are closely regulated under the Controlled Drugs and Substances Act and other acts in Canada. Opioid usage is only legal when prescribed by licensed practitioners and the correct doses are consumed. Illegal possession of opioid can result in up to 7 years of imprisonment, and trafficking and producing opioids can cause life imprisonment. But the question remains, how do we arrive at the present state where thousands are dying every year from opioid consumptions, despite the strict regulations on the drug? There are primarily two factors that have allowed opioids to emerge as such a problematic drug. First, overprescription and overuse. Opioid is used to counter pain, and pain is one of the most common reasons for seeking healthcare in North America. It is estimated that 1 in 5 Canadians experience chronic pain. However, in the 2017 Canadian Guideline for Opioid Therapy and Chronic Non-Cancer Pain Treatment, it is recommended to use non-opioid drugs and non-pharmacological therapy over opioid for Canadians with chronic pain. But despite this, prescribers have prioritized opioids as one of the main approaches to address chronic pain. A 2017 report found that in 2015 to 2016, about 2 million individuals, or 1 in 7 people, filed an opioid prescription in the past year. According to 2018 Canadian Community Health Survey, 1 in 8 people were prescribed opioids. Further, over 40.5% of Canadians aged 15 and older, which is approximately 11.8 million people, have used pain relief medications containing opioids such as morphine at some point in their life. Opioids are extremely common medications. Now, of course, this wasn't always the case. The ubiquity of opioid has been a result of aggressive and false promotion of opioid as low risk, non-addictive, and the optimal treatment for moderate pain in North America by medical suppliers.
Once you've found the right doctor and have told him or her about your pain, don't be afraid to take what they give you. Often, it will be an opioid medication. Some patients may be afraid of taking opioids because they're perceived as too strong or addictive. But that is far from actual fact. Less than 1% of patients taking opioids actually become addicted. And any drowsiness that might occur when you start to take the medication will soon wear off in most patients.
In fact, Purdue Pharma, one of the biggest suppliers for opioid, faced lawsuits in recent years from promotion of oxycodone and agreed to plead guilty to criminal charges for its role in the fueling of America's opioid crisis. Purdue Pharma will admit to enabling the supply of drugs, quote, without legitimate medical purpose. Second, the ubiquity of opioid has been the result of an infective response. Initiatives to reduce medical opioid prescriptions were acted upon, including the descheduling of selected opioid drugs, prescription monitoring, and stricter guidelines for prescribing opioid. This, instead of reducing opioid fatalities, only resulted in a surge of illicit opioid supply to refill the supply gaps. The result was the rise in availability of more dangerous opioid drugs such as fentanyl. Users are put at a higher risk of overdosing when consuming these drugs. For example, a few milligrams of fentanyl can be lethal. Data from countless provinces reflect this. For example, as shown in this graph of opioid cases in Ontario, the number of cases rose significantly in past years, and 2012 was the starting point, which is when most regulations were starting to be introduced. To further exemplify the ineffectiveness of regulations, I will focus specifically on one guideline, the 2017 Guideline for Opioid Therapy and Chronic Non-Cancer Pain. So the guideline created major changes in opioid prescription that limited the availability of opioid in a number of ways. For example, physicians will now need to adhere to new ceilings of doses when administering opioid. Physicians will also consider the alternative medications that can be used as first-line options for pain treatments. Now this sounds like good choices and good beneficial regulations, but in practice, this has led to many unintended effects. For example, provincial regulators have already investigated and inspected doctors who prescribed high doses of opioids to their patients. As such, many primary care physicians are now fearful of administering opioid, leading to a greater decrease in opioid than intended. Some primary care physicians have dropped patients whom they had prescribed opioid, and others have completely stopped prescribing opioid altogether in fear of violating the guidelines. This greatly affects patients who are currently using opioid, especially patients who are suffering from opioid use disorder, which is when patients are physically dependent on opioids. Some of the side effects of OUD includes increased tolerance, trouble reducing use, and withdrawal symptoms with discontinuation. The Canadian opioid guidelines estimate a prevalence of OUD in patients with chronic non-cancer pain who are prescribed opioid to be 10%. However, even non-OUD patients will also be at risk of negative impacts from opioid consumption being abruptly limited. Further, the atmosphere of fear created from the regulation led to many physicians to refuse to assume care of patients requiring opioids due to chronic pain. It is estimated that around 20% of Canadians living with chronic pain might not receive the adequate care. As previously mentioned, when no longer consuming the same amount of opioid, one will experience withdrawal symptoms. These include severe anxiety, dysphoria, and escalation in pain. Withdrawal symptoms can also include depression and even suicidal intentions in patients. Further, patients now with nowhere to go for opioids often seek to obtain opioid with legal means, such as obtaining them from multiple prescriptions from physicians without informing them of other prescriptions. This is known as double doctoring. Prescription fraud, forgery, theft, street drug markets, and internet purchases are other ways to obtain opioids illegally. A troubling Canadian study found that only 37% of opioid-dependent patients admitted to the Centre for Addiction and Mental Health in Toronto reported receiving opioids solely from physician prescriptions, compared to an astounding 26% of patients who received opioids from both prescription and illicit sources, and 21% from only illicit sources. Furthermore, the consumption of illicit drugs are not only more toxic, but also puts the patients at an increased risk environment. Patients are not forced to use opioid without supervision and in often unsanitary conditions. This opens up greater possibility for overdose and infections. In fact, data shows that 80% of opioid-related death results from illicit fentanyl injection in unsupervised sites. Although the guideline for opioid therapy and chronic non-cancer pain treatment note that the reduction of opioid for users can be abandoned if any substantial increase in pain or decrease in function in your patient occurs, at that point, due to your patient's exposure to a long period without opioid use, the patients will now face a period of increased risk for overdose due to the reduced tolerance from a long period of lack of opioid consumption. In summary, the 2017 Canadian Opioid Prescribing Guidelines, as well as other attempts to regulate opioid usage, were often introduced to a health system ill-equipped to care for patients with chronic pain. So, these two factors have led to the opioid crisis of today. But unfortunately, that is not all. Opioid consumption actually has seen further increase due to the COVID-19 pandemic. The number of opioid-related deaths increased quickly in weeks following the state of emergency of declaration in Ontario on March 17, 2020. Overall, there was a 38.2% increase in opioid-related deaths in the first 15 weeks of COVID-19 pandemic compared to the 15 weeks prior. The stats from January to June 2020 are as follows. 2,670 apparent deaths have occurred. 2,368 hospitalizations as a result of opioid poisoning have occurred. There were also 12,100 emergency medical responses for suspected opioid overdoses. In June 2020, Ontario's chief coroner announced a 25% increase in suspected drug-related deaths between March and May 2020, compared to the monthly median reported in 2019. By August, more people have died from drug overdose than the people that died in the total of 2019. People who use opioids have reported a loss of social connection and support, as well as an increase in isolation, fear, and anxiety. This has made them more vulnerable to the health impacts and hardships of social distancing. Lastly, guidelines for delivery of substance use treatment and services during pandemic are not adequately developed, for example, those in British Columbia. A worrying piece of data shows that more people in British Columbia have died from opioid overdose than COVID-19. So, in conclusion, the opioid crisis in Canada is one that is ending the lives of thousands every year, but worst of all, it is one that goes largely unnoticed. Many people do not even know of the existence of this crisis, and it is something that must be called attention to. More careful measures must be put in to respond to this crisis, and policymakers must consult data more closely and more closely inspect the situation to make sure that the installed guidelines are not worsening the very issue they are trying to solve. Though the situations are looking grim, let us hope that we can overcome this crisis.